Acute tubular necrosis. It is seen in kidney. The name itself is saying that it is a acute condition seen in the tubules resulting in necrosis. So acute tubular necrosis causes will be the causes may be ischemic causes or toxic causes. Ischemic causes include shock, crush injuries, non-traumatic rhabdomyolysis, mismatched blood transfusions. And coming to the toxic causes, it may be because of the poisons or heavy metals or drugs or radiographic contrasting media. Whether it is ischemic cause or toxic cause, it will end up in tubular necrosis. If it is ischemic cause, there will be arteriolar vasoconstriction. By renin-angiotensin mechanism, there will be glomerular shutdown. And thereby there will be tubular ischemia resulting in tubular necrosis. This is the pathogenesis of ischemic causes causing acute tubular necrosis or ischemic tubular necrosis. We can say like that. Coming to toxic causes, they will cause direct tubular damage resulting in tubular necrosis. So this can be also called as direct tubular necrosis or toxic tubular necrosis. Toxic type. After the tubular necrosis, there will be reduced glomerular filtration rate, which will result in oliguria, decreased urinary output less than 500 ml. The tubular necrosis will end up in desquamated epithelial debris, thereby causing CAS. There will be tubular obstruction, which will lead to increased tubular pressure and thereby causing damage to the tubular basement membrane and tubular rupture. As a result of the tubular rupture, there will be leakage of the tubular fluid into the interstitium, which will result in interstitial edema. Because of the interstitial edema, there will be rise in the interstitial pressure, which will cause a response, that is inflammatory response. Thereby, there will be, because of the inflammatory response, there will be compression of the tubules and interstitial vessels. This will again promote tubular necrosis. This is a cascade of tubular necrosis. In the picture, if you see, there are two types of acute tubular necrosis. One is ischemic type and other is toxic type. If you see the picture here, the casts are present all over DCT, okay, right? Here also in toxic type also they are present. Here they are alternate casts and necrosis, just like bands in ischemic type, whereas here the necrosis is continuous in toxic type. In the exam, they may ask you for 6 marks question or a 3 marks question. What is acute tubular necrosis of the kidney? So it is the necrosis in tubules of the kidney. It can be proximal or it can be distal. It can be two types, ischemic and toxic. Toxic and ischemic. Ischemic acute tubular necrosis is also called as tubulorectic. Rectic acute tubular necrosis or lower tube ischemic acute tubular necrosis. As it is involving the distal nephrons, it is lower nephron nephrosis or it is causing anoxia. So it is also called as anoxic nephrosis or shock kidney. So shock kidney, tubulorectic acute tubular necrosis, lower nephron nephrosis, anoxic nephrosis are all the synonyms of ischemic acute tubular necrosis. Whereas toxic acute tubular necrosis will cause toxicity to the kidney. So it is also called as nephrotoxic acute tubular necrosis and it is involving the proximal nephron. So, upper nephron nephrosis or toxic acute tubular necrosis. So, the synonyms for toxic acute tubular necrosis will be nephrotoxic acute tubular necrosis, upper nephron nephrosis. The frequency when compared to toxic acute tubular necrosis, ischemic acute tubular necrosis is more common. 80% of the cases of acute tubular necrosis will be ischemic. The etiology, as I discussed earlier, it may be shock or crush injuries or mismatched blood transfusion in ischemic acute tubular necrosis. It is because of the toxins or the heavy metals or the poisons or some drugs that is causing toxic acute tubular necrosis. Coming to the gross examination, the kidneys will be similar, enlarged, swollen, cut section will show pale cortex and dark medulla. In both ischemic and toxic acute tubular necrosis, gross examination features will be similar. The kidney, first it will get enlarged, it will be swollen, cut section will show pale cortex and dark medulla. Coming to the microscopic examination, here there will be difference between a ischemic acute tubular necrosis and toxic acute tubular necrosis. The ischemic acute tubular necrosis is more prominent in the distal tubules, so there will be more damage in the distal tubules. Whereas toxic acute tubular necrosis, it is present in the proximal tubules, so more prominent damage will be seen in the proximal tubules. There will be focal tubular necrosis in the ischemic acute tubular necrosis, whereas it is more diffuse tubular injury in toxic acute tubular necrosis. In both, regeneration epithelium is common. Coming to the CAS, the CAS are hyaline CAS or pigment CAS or myoglobin CAS that are seen in ischemic acute tubular necrosis, whereas the tubular lamina will show dystrophic calcification because of the toxins in toxic acute tubular necrosis. The basement membrane will be disrupted in the ischemic acute tubular necrosis, whereas it is intact in toxic acute tubular necrosis. The prognosis will be worse for ischemic acute tubular necrosis, whereas it is good for toxic acute tubular necrosis. In a simple way, ischemic acute tubular necrosis is tubulorectic or lower nephron nephrosis, and because of it, because of the anoxia, so anoxic nephrosis or short kidney more common, and it is the pale cortex and dark medulla with distal tubular damage more prominent, and there will be focal tubular necrosis. The basement membrane will be disrupted in ischemic acute tubular necrosis. As the basement membrane is disrupted and focal tubular necrosis, there will be worse prognosis in cases of ischemic acute tubular necrosis. There will be good prognosis for toxic acute tubular necrosis because the basement membrane is intact and the injuries will be more diffuse and more prominent. Proximal tubular damage is seen, and it is because of the toxins. So if we avoid the toxins, then this toxic acute tubular necrosis can be avoided. As you see in the picture, these are the pictures from Harsh Mohan. These two pictures are from Harsh Mohan. This is ischemic acute tubular necrosis. Here you will be able to appreciate the hyaline CAS, and there is disrupted tubular basement membrane, which is characteristic of ischemic acute tubular necrosis. So this is all ischemic acute tubular necrosis. Whereas in here you will see the granular CAS are intact tubular basement membrane, and you will be able to appreciate a dystrophic calcification in toxic acute tubular necrosis. This is a basic difference. Calcification seen in toxic acute tubular necrosis, basement membrane will be intact. Hyaline CAS is seen in ischemic acute tubular necrosis, and the basement membrane will be disrupted. Thank you for patient listening. Please like, share and subscribe Dr. Ravichandra Official for more interesting videos on pathology.